I'm Linda Song from Leeds University Business School, and my research is on cultural intelligence training and ethnic minority colleagues in NHS, and how human resource management practices can influence their well-being. And then this is our team. You can see myself, Ahmed Mustafa from Egypt, and then Ola from Poland, and also two research fellows from China and from UK. Yeah, so we are a diversified team as well. So we got some report that is NHS workforce has we got 24% of ethnic minorities. Now we don't call them BAME, we call ethnic minorities. And then, so they are very talented, but their development in NHS is limited. And also they report some kind of discrimination, harassment, bullying, etc. So we try to help them. So we already got a kind of UKI funding from 2020 to 2021, focusing on COVID-19 impact on NHS colleagues' well-being and how human resource management practices can support them, what we can do. So these are some very salient practical and strategic implications for the EDI research and practices. So our motivation is to say that when we see NHS is very great, everybody clap for NHS, and we know NHS the day before yesterday celebrated the 75 years anniversary. So great NHS, we know that, but we want to focus on NHS colleagues' well-being, especially ethnic minorities. You know that most of them focusing on grade 3 and grade 4. Very few of them can promote grade 6 or grade 7. So all the interviews and survey studies that we conducted using the UKI funding, we found that very, very few people can get a very great support or promotion, etc. So we try to help them. We try to take care of them. We try to pay more attention to them. We try to increase their well-being using our expertise, which is human resource management practices support. So we got work packages. These are in survey and interviews and co-design or pilot of the new interventions. These are all happened in UKI funding. And luckily, we got the English policy funding now, and then so we look into impact. We try to focus on the impact and try to have more stakeholders, more partners to work together with us to increase the impact of the research. So these are the summary. We already finished our first paper. We are going to submit to the journal regarding the empirical studies results. And these are the qualitative study as well. You can see we have several themes: NHS, human resource management practices and well-being, dedicated support and proactive behaviors, and diversity and well-being. So we got all the qualitative and survey data, and we try to write papers and have theoretical contributions. So these are our papers. So Paul is our senior policy engagement researcher and officer in our Leeds University School. He looked at the paper, he asked a question of so what? So the policy implications, so what we can do out of the policy, the strategic importance, how we can sell to the audience, like just now question is very great. So we focus on cultural intelligence. So we think that cultural intelligence in the literature got 4 dimensions: awareness of the cultural differences. We got knowledge, cognition, and strategy, metacognition to get whether you understand, you know that you are good at cultural intelligence, and action, which is behavior, whether you can, as a leader, for example, in the NHS, can you really adopt some behaviors and then try to move the table around and try to change the things, try to promote the NHS colleagues' well-being. So this is very, very important. So for example, very we got very good citation from the interviews. One of them is about the recognition. So for example, we found that very few NHS colleagues with ethnic minority background can become a story in the newsletter, can be cover story in the newsletter. Not many people got to know that we have very excellent ethnic minority colleagues as role models. So we need to promote this. We need to ensure that managers in NHS try to recognize, reward not only white colleagues, but also ethnic minority colleagues from Philippines, from India, from Pakistan, from many other places, from Egypt, from Africa, etc. So these are very, very important. So based on our research, we found that the culture is very, very important. We need to celebrate the festival. We need to understand what are the cultural implications. So these are very, very important. We try to develop the culture training in the future. So we use this grant, and we successfully conducted some workshops. And yesterday we got a full-day workshop at the Park Plaza, and then we got City Council colleagues, and Paul presented. We got City Council Macy and went there, and then also we got people from NHS. We got chief nurse from NHS. We got Health Watch to look into the monitoring the NHS development. We got all the stakeholders coming into and discuss together. We got 50 people in the room, and then we plan to have impact, and we plan to work continuously with the support with City Council, with everybody. We wish to continue with the research. Thank you so much. So this is our training development, and then some of the technical reports. So we want to have video, want to have case study, we want to have themes from interview. So it's research, impact, connected, hand in hand, try to give impact. So we try to give certificates, also integrate into NHS training accordingly. Also, we want to do the training for City Council. I know City Council also very good at the research of the culture. Thank you. My time is up.